Hi, I'm Dr. Goldi Jacques-Maynes, Golden Chiropractic in Aptos, California. Sometimes your back really frickin' hurts and it sucks and you don't know what to do. Here are some really simple stretches that you can do. Many of these, I would say all of them, you can do in bed in case you get stuck there, because sometimes it happens. So you wake up and you can't move and you're on the ground, or you're on your bed, or wherever you are. And I just want you to take a deep breath, okay? It seems like the end of the world. I know you think it's never gonna go away, but it will, and it does. And here's some really simple things to do. The first thing you wanna do is take a deep breath. Put your hand on your belly, in and out, feeling the rise and fall of your stomach. If it helps, place one hand on your chest and the other on your belly, just so that you can really focus on what it feels like to breathe into the stomach. You can take a breath in, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4, inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, okay? And you can stay here in this phase of the stretch as long as you need until you feel like you're calming down a bit. Now, I'm gonna slowly lean my knees to one side. I'm gonna pick my left side and I'm gonna continue breathing. And you're gonna feel a stretch across the abdomen here, maybe into your low back. Sometimes people get a lot of pain at the joint, kind of if you put your hands on your hip where your thumb hits you. And this may feel like an uncomfortable stretch. Now, I'm trying to keep my right hip towards the ground, and I'm gonna almost spread my legs a little bit here. So rather than having my ankles together, I'm kind of opening them up a little bit so I can really focus on keeping this right hip. It's lifted a little, but I'm not like really rotated, right? And now I'm gonna focus on breathing into this space right here. The right lower quadrant of my belly. Breathing in and out and in and holding and out. And just feeling that area just relax, calming down. Now go ahead and bring your knees back to center. Straighten yourself out a little bit if you need to. And take a breath in and out, leaning over to the other side. I have a block here, so sometimes you're in a lot of discomfort and pain and you just don't want your legs hanging so much. You can place a block or a pillow to kind of hold the knee. I'll show you what that looks like on this side, sort of like that, right? So I'm not fully twisted, putting as much strain on my back. So feel free to use the blocks if you need to. Breathing into the left side of my pelvis. In and out. Good. Again, staying here in this position as long as you need until you feel the muscles relaxing and stretching very gently. Okay? We're going to go back to the center. I'm going to breathe in and out, and now I'm going to focus on flattening the curve of your back. So in your low back, you have what's called a lumbar lordosis. So if I extend my back and arch my back, you can slide your hand under here, but we're not going to do that. What I'm going to have you do is take a breath. You're going to slowly draw in the muscles of your stomach, like you're taking your belly button and you're sliding it towards the ground, right? Flattening the curve of your back. Now I'm not continuing to lift up through my pelvis. It's just a reversal of the lumbar curve. When you're in acute pain, this might be too much for you, so don't do this exercise, okay? Just breathe, exhale, draw the belly in, flatten your back. You can have your hands by your side, or you can have them on your belly, whatever works better for you. Good. Breathing in and exhaling out. Bring your knee to your chest. Breathing in and out slowly. Holding here for several breaths. Some people can bring their knee really far to their chest and extend the leg. Some of us are just really tight through our hip flexors, and it's okay to kind of have the hands straight and the knee out there. If that's too hard, drop your hands. You could even grab a belt or a strap and kind of put it behind your knee if you can't get that close, okay? And the other side. Breathing in and out. If you can, bring both knees to your chest. Take a couple of deep breaths here. In and out. You may be able to bring your knees really close. It may be enough just to stretch it here, or again, you could put a belt or a strap behind your knees, and maybe your knees are out here with the strap, okay? Whatever it is, no problem, it's just where you are today. If you want to, you can gently rock back and forth, sort of massaging your low back, if you will. Again, if you're in acute or intense pain, you might not be able to twist today, and that's okay. Maybe tomorrow. Try it again later tonight. We're going to finish again by breathing into the belly and exhaling. I hope that's helpful. If I can be of service, please schedule a chiropractic adjustment. Otherwise, I hope these breathing exercises help your low back.